There are many changes that took place during, for example, last 100 years. One of them is due to Industrial Revolution. 100 years ago, people were walking physically much longer time, often 5, 6, 8, 10 hours every day. And it probably affects our breathing. Let us consider how. When we exercise, our breathing is heavy, it's much heavier. We can breathe 50, 100, up to 150 liters per minute. So we can probably think, maybe it's not so good for health, but we generate much more energy, we burn carbohydrates, and we produce much more CO2, 10, 15, 20 or even more times. So we have to think what is going on with carbon dioxide inside our blood and lungs. In fact, if we exercise and breathe through the nose, it's very beneficial for health. CO2 concentration gets higher. And because of that, our breathing center, located in the medulla oblongata of the brain, adapts to high CO2 level. This is exactly what Dr. Buteyko wrote about physical activity. During prolonged intensive exercise, the receptors which control breathing adapt to increased CO2. If the person regularly walks and toils, then he practically follows our method. He is decreasing his breathing using exercise. Dr. Buteyko, public lecture in the Moscow State University on 9 December 1969. Moreover, Dr. Buteyko suggested that physical activity can probably be as good as breathing exercises in order to cure many diseases. And this is what he said at the same lecture. Hence, the diseases can be cured by regular physical exercise. There is no need to spend 3 hours every day for breathing retraining. Instead, one should walk hard 5 hours per day till perspiration. This will cure asthma, hypertension, angina pectoris and other diseases. When I meet with my students, I usually find out that most of them, up to probably 80–90%, exercise too little. Just 10, 20, 30 minutes per day. This is too little for us. During our evolution, we can imagine we had much more physical activity, just walking every day. And Dr. Buteyko also wrote about this. Lack of physical activity is as harmful as lack of vitamins, water or food. 3 hours of good physical labor per day with perspiration or the equivalent physical activity, this is the norm for the average person. Dr. Buteyko, public lecture in the Moscow State University, 1972. Moreover, Dr. Buteyko and Russian doctor suggest that physical inactivity is cause number 1 for chronic hyperventilation in the modern population. So I write 1, physical inactivity. Physical inactivity. What should be emphasized during physical exercise is that the person should breathe only through the nose. It is exceptionally important, because when we breathe through the mouth, CO2 in the body is not the same. And because of that, it is usually not possible for sick people to exercise. Consider again patients with heart disease, asthma, other conditions, who usually have about 10, 12, 15 seconds breath holding time. If they start to jog, or maybe they start cycling, or do some other intensive activity, they start to breathe through the mouth. Therefore, it is not good for them to exercise at high intensity or medium intensity. Best for them would be walking. And it's indeed that Hippocrates, the father of medicine, wrote 2,500 years ago that walking is the best medicine. Now when they achieve breath holding time up to about 20 seconds or more, then they can start jogging while breathing only through the nose. So we can now conclude that nasal breathing is exceptionally important for our health. The next parameter of causes of hyperventilation is stress. When we were discussing the evolution section, we found out that in the past, when oxygen content was small on the earth and CO2 was abundant, any stress produced hyperventilation, and it was a very useful reaction. Why? Because oxygen was small, so that to get more oxygen we were heavily breathing. And what is also normal, we would never develop these health abnormalities related to low CO2, because CO2 is very, very high. Now, this reflex instinct became ingrained in our nervous system. Right now, air composition is very different, and the same heavy breathing produces totally opposite result. Instead of getting more oxygen, we get less and less. So, when we react to stress now in various situations, we make our health worse and worse. This is, for example, what happens with people who are dying from heart attacks, asthma attacks, stroke, other health problems. We are in the state of severe stress, and trying to get more oxygen, they continue to breathe more and more heavy. But the more heavy they breathe, the less oxygen they get. So we are dying in conditions of severe stress and severe hyperventilation. But we are also born with the same reflex, same instinct. Think about the baby who is just born. In the womb of the mother, the embryo has very different gas composition. CO2 is very high, oxygen concentration is very small, as it was billions of years ago. But now this air is totally different. And when the baby is born, the baby starts to hyperventilate just after the delivery. How to prevent it? Wisdom of human cultures from all over the world suggested that swaddling is one of the very good solutions. When baby is tightly wrapped, it cannot breathe heavy after the birth. So let me write here, lack of swaddling, because lack of the swaddling is modern health problem.